Hello and welcome to today's show. My name is Keisha Pickett, and today we're going to celebrate and speak about prostate cancer and breast cancer, celebrating the National Minority Cancer Awareness Week as well as National Minority Health Month. And today I have with me Dr. Brian Rivers from the Florida Prostate Cancer Network and Ms. Sonia Franklin, a member of Tampa-based chapter of Sisters Network. Welcome and thank you for joining me.
Thanks for having us.
All right, so this week we are celebrating Minority Cancer Awareness Week, and the month, of course, is National Minority Health Month, which we are going to be observing plenty of organizations educating the minority community about various issues, whether it be diabetes or cancer and different health issues that we need to address, not just this month, but throughout our lives and throughout the year. So today we're going to talk about cancer. Prostate cancer, which mostly affects, of course, men,
Sure.
and breast cancer, which affects the women in the minority community, particularly the African American community. Brian, can you tell us a little bit about the Florida Prostate Cancer Network and how long you've been established and kind of how you got started?
Sure. Well, the Florida Prostate Cancer Network was established in 1997 by prostate cancer survivor Bob Samuels. Bob Samuels is a 14-year prostate cancer survivor, and the impetus behind the origin of the organization was because of how he entered into his diagnosis with prostate cancer. He was going for routine screening, and inadvertently they were not checking him for prostate cancer. Among dialoguing with a colleague of his, he realized that his colleague came down with prostate cancer, so he decided to go back to his healthcare provider and get reassessed to see if he was being checked for prostate cancer. Well, lo and behold, he actually was checked for prostate cancer and actually was diagnosed with prostate cancer around the same time. So in a quest to ensure that there's proper information and proper awareness in the community about this disease, especially among African American men who are disproportionately impacted by this disease. Bob Samuels founded the Florida Prostate Cancer Network, purpose solely to educate all Floridians about the extent and impact of prostate cancer in the state of Florida. And so that's how the organization came about. We're celebrating 10 years of service, of educating all Floridians about prostate cancer. The organization has made tremendous strides. I was brought on board in September of 2006 to really continue on in some of the efforts of Bob Samuels, who's retired, but unfortunately we brought him out of retirement, and he's again chairman of the board of directors. So we're glad to have him back in that slot, and we've been working together. We implemented the African American Men's Health Forum this past March, and it was a huge success, and we just have great momentum, and we're just continuing the efforts of the organization. I'm just glad to be a part of it.
Well, we will definitely find out more about the African American Men's Health Forum and what else you have coming up with the Florida Prostate Cancer Network.
Definitely.
And Ms. Sonia Franklin, you are with Sisters Network, Tampa Bay chapter, and we would appreciate if you could tell us more about this great organization that supports education and awareness of breast cancer in African American women.
Sure. Sisters Network was organized and formed in Texas by a woman named Karen Jackson. She organized the group with 14 women. And today we have 40 chapters over the United States.
Awesome.
Our Tampa chapter was located and formed here by Karen McGinnis in 2005. A breast cancer survivor herself, she looked for an organization to support African American women and women that needed some support, that moral, that uplift, that head seeking what's going on with breast cancer. And Wanda started the chapter here, and I am the public service representative for the Tampa chapter of Sisters Network, and we are looking, forming, striving, talking, touching, and walking, trying to let African American women know that it's okay. Breast cancer may come, but we can survive it if we stick together and check ourselves.
Definitely. Well, awesome. Sonia, how many members would you say the chapter or nationally do you have in this organization? It's fairly new.
It's fairly new.
How many members are we working with now? And I know you're seeking new members, so if anybody is watching this program and is a cancer survivor, breast cancer survivor, I encourage them to contact Sisters, and we will give you contact information later on in the program. But tell us more about your chapter and the activities that you have going on, the members that are within the chapter. I know that you've shared with me that all of the members, or most of the members, are actual cancer survivors. You yourself are a cancer survivor. Can you tell me about that?
Yes. Our membership is small. We have approximately 20 members
Okay.
in our organization, and we do have associate members. Our associate members are not survivors,
Okay.
but they are sisters, their brothers, their aunts, their mothers of cancer survivors. And they help us along our way in making sure that we have the assistance that we need. So we have new members. We're actively looking for more members. We're actively looking to help support those that are going through. And as you said, that I am a 8.5-year cancer survivor.
good.
So, and diagnosed at 38. Who knew that
Right.
I would, someday have cancer at 38?
Right.
38, that's a young year. I had 2 young children and was full of life. And there it was.
There it was.
So we at Sisters Network, we want to let young women know that we're here to support you. We're
Okay.
here to walk with you. We're here to give you that encouragement that checking and loving yourself and examining yourself, you still can survive. So that's what Sisters Network is. It's a survival program to help those that are going through and to support those that have been through the
Right.
steps of cancer.
All right, and speaking of, you're 38, you're full of life, you have children, no idea that you have cancer, and I've heard many women say, okay, at 20, I'm not even 30 yet, but I've asked, about mammograms, and they say, oh, you're too young, do the self-test, things like that. For both, Brian, when should men start getting tested for prostate cancer?
Okay. Well, based on the averages, and those are the
And I'm sorry, and tell
recommendations.
me what they should look for.
Sure. Okay. Well, based on the averages, and again, those are just recommendations. They are just averages. So meaning some men may have to be screened earlier than the recommendation, and some men perhaps later. But the recommendation is, if you're African American, that you begin at the age of 40 to be screened for prostate cancer. If you have a family history, then it's very important that you begin at the age of 40. And for all other men, at the age of 50,
Okay.
to begin screening for prostate cancer. Some common signs, while there aren't no real signs to really announce, but some common occurrences that do take place that could result in prostate cancer includes frequent urination, blood in the urine, blood in the semen, pain in the lower region of the pelvic area, blood in the stool. So all these are indicators that something is going on in that general area. Again, it may not necessarily mean that it's prostate cancer, but it could be an infected prostate or an enlarged prostate gland. The idea is to not sit on, when you realize that you have these risk factors and they're really sort of exemplifying themselves, the idea is to not just sit there, but go and get checked out. Have that conversation with your healthcare provider to see what's going on in that region of the body.
Okay, so it's when someone, or if a man is experiencing these symptoms, they should, automatically go, just because, and like you said, but an enlarged prostate, or
Sure.
that could lead to the prostate cancer, right?
Exactly. Or an infected prostate, which may not even lead to prostate cancer per se, but you just have an infected prostate gland. The idea is just to go and get it checked out immediately, because if it is in fact prostate cancer, if it's caught early enough, it's 100% treatable,
Okay.
and that's what we're after.
Okay.
Just early detection. That's the key.
All right. Now, I've heard that it's not the easiest test for a man to
Sure.
take, and it's not the one that they're going to be willing to just go jump and take.
Exactly.
So I don't know how how do you encourage me, because it's really it's a process. I'm not a man, I'll
Sure,
never go through
sure,
it, but I've
exactly.
just heard some friends,
Exactly.
and colleagues, and within talking about the experience of having to go through a prostate cancer test. Are there any other ways? Are they developing any other ways, or just one way in, and that's
Sure.
it?
Well, unfortunately, there are 2 screening modalities that
Okay.
are recommended, and the 2 have to be sort of administered in tandem, and that's the
Okay.
prostate-specific antigen, which is a blood test that looks for the protein in the bloodstream, a high amount of the protein in the bloodstream, which is indicative that something is going awry in the area around the prostate gland. And then the other one is a digital rectal exam, which is not the most comfortable exam.
Right.
It entails insertion of the digital or the finger into the rectum to feel around for the prostate gland to see if there's any abnormalities. While both procedures may seem a bit uncomfortable, you have to look at it in the grand scheme of things.
Exactly.
And you have to ask yourself quantity of life versus quality of life.
Exactly.
And is longevity important to me, or is the prostate gland,
Right. Right.
just who I am. And of course, as men, we're more than that.
Exactly.
And we have to keep that in context. So, the 2 minutes of uncomfortableness that you may, feel as a
Save a
result,
lifetime.
I mean, it can save your life in the long
Right.
term. And,
Right.
you can see your grandkids and great grandkids go off and do great things and be highly productive in society.
Right.
So don't you want to be here for that?
Exactly.
Don't you want to be here to pass that wisdom on to them?
Trust me, all the men in my life will be taking prostate cancer.
That's great to know. That is great to know.
All right, Sonia. Tell me a little bit more about when young women or women should start getting mammograms, or I know that we're, told by our physicians every month that we should check our breasts and make sure everything is feeling quite the same if we notice anything to go and see our physician. Can you tell me more about the testing process or the detection and signs that women should look for when
Sure. Statistically, it said that all women should start having mammograms around the age of 40. Same thing with prostates, around the age of 40. But like I said, I started at 38.
Right.
My cancer was diagnosed at 38. So the key, even at before 40, is check yourself. Do your own self examinations, because we're dying at an alarming rate. Every year, this year, 2007, I say this year, but 2007 alone, we had 15,000 African American women diagnosed with breast cancer. That's a lot.
Wow.
And we had over 7,000 of those to die.
Wow.
Why? Because they didn't get checked. Because it was 40 and they didn't get checked. They were 45 and they didn't get checked.
Yeah.
But basically, they're 35 and they check themselves and pass it on. Ask the doctors, check with your providers, get those tests. Make sure that you're doing what you need to do.
Right.
Those saying is love, love thyself. Love yourself.
Right.
Check yourself. Get those tests done. If you get those tests done, then you can. It may come, but you can survive.
Right.
I was 38 then, and everybody said, "Okay, well, how old are you now?" Well,
Right.
now I'm 46. I was gonna say 45. I had a birthday last year. I'm glad to say 46.
Yeah.
Because my cancer started at 38. I'm okay.
Right. What
Okay.
signs should women look for when they're doing their self-exams?
Self-examination, for me, I had a lumpectomy. I didn't have to have a mastectomy. A lumpectomy versus a mastectomy, what's the two? Because I checked myself, I found my cancer, and it was smaller than a pea.
Okay.
But in smaller than a pea, I had cancer in my lymph node. So what does that mean? When it's smaller than a pea, I was in stage 1. You have 5 stages to cancer. I went from a stage 1 to stage 3. But because of early detection, the doctors were able to treat. You look for maybe redness. You look for the change of your breasts and your nipples. You look for, I didn't have a physical sign. I just failed. And up under my armpit, I failed a pea of something that wasn't normal.
And a pea is like extremely small. How?
A pea of
Wow.
just a little pea, and I'm like, okay, what are the things that we do naturally that people don't know that can cause cysts? Coffee, caffeinated teas, chocolates, potato chips, those type items. I knew better. I backed off. So I called my doctor. Have a good provider. Key to the whole thing is having a good provider. And I called my doctor and I said, I don't like what I feel. My provider said, if you don't like it, I don't like it.
Okay.
And in turns, I did the mammogram, which you should have standard. And if something with the mammogram didn't come out, he said, take a sonogram. And there we found something that we thought was very suspicious. And in turn, it was. It was cancer. It was present. So the whole thing is, it may be a bump that you get appear on your breast that is something different and don't go away.
Right.
Check it out.
Right.
It may be a redness that's on your breast, under your breast, beside your breast that won't go away. Itchy skin that may be there. It's not necessarily what you see, it's what you feel.
Right.
And a combination of the two. So it may be something you feel, it may be something you see. Check
Okay.
out your breast. If something changed and it's not normal, don't put a salve on it or Band-Aid on it and say it'll go away.
Right.
Go
And
get
get it
yourself checked.
Speaking of testing and getting checked, Brian, the Florida Prostate Cancer Network hosts the African American Men's Health Forum every year.
That's correct.
And you are just March 1st, just passed, you had your eighth annual,
Yes.
which I heard was very successful with over 1,500 people coming out.
Yes.
And over the years, I believe you've seen close to 10,000 men
Yeah.
and women, because you do offer services for them as well, but mostly
Exactly.
for the men for the prostate cancer and cholesterol high or diabetes, hypertension testing that you do.
Sure.
Tell me about your past, forums, your health forums, and
Okay.
about the one that just passed here this year, and what you do at that event.
Okay. Well, the African American Men's Health Forum, as you mentioned, we're fortunate enough to host our 8th annual one, and really appreciate all of your efforts in that regard. You
Sure, sure.
really assisted in the promotion of the event. But it's a very timely event. It's a very needed event. And the citizens of Tampa Bay really look forward to this event. We did not do it in 2007 because I was just coming on board and I was still getting acclimated. And the community really let me know that they missed the event and they really wanted it back.
That's awesome.
So we responded this year, and we had a great turnout, a great response. Over 1,500 men in attendance, as you made mention of, and cumulatively over the past 8 years of implementing this event, we have reached over 10,000 men, and we are actually saving lives. And it assists, and I think the vision came through Bob Samuels once again, and he recognized the need to address African American men's health. We know that they're disproportionately suffering from almost every major disease out there,
Right.
and that the life expectancy on average is 7.1 years less in comparison to men of other racial and ethnic groups. So we have a lot of premature deaths where individuals are not even making it to age 70 years of age.
Wow.
So what's the response to that? Yes, we say access and utilization, go to your healthcare provider, but then we deal with issues of distrust and fear of the medical establishment for things that have happened historically with Tuskegee and the syphilis experiment. So there's a lot of cultural myths and cultural biases that sort of get in the way and serve as barriers to men with insurance actually interfacing with a healthcare provider. But the African American Men's Health Forum is a place where they feel comfortable, where they trust individuals that are there administering various services. They feel that they're welcome, that they're respected, and they're highly regarded. They're not frowned upon. So that's why men, I think, have continued to come out year after year. And at this event, it's a community-based event. It's not the Florida Prostate Cancer. We're just the host or the facilitator of it. But it's a time when all the hospitals come together with their
Yeah.
resources. All the community-based organizations and faith-based organizations and civic groups such as fraternities and sororities and other groups, the Charmettes and 100 Black Men, 100 Black Women, just to name a few, all come together with their resources and they put them on the table and share them equally. And I mean, it's just a fantastic event. This year we're able to administer close to 400 prostate cancer screenings free of no charge to men. We were able to administer over 400 cholesterol screenings and diabetes screenings, and handed out close to 100 colon kits for people to assess if they have colon cancer or not. And we did HIV and AIDS screening out there. And then as well, not focused solely on the secondary levels of prevention, but also the primary. And we had a number of educational workshops and physician expert panels really detailing how you can prevent these diseases. And that's what the event is after, raising educational levels or knowledge levels, as well as awareness of these different diseases and how they're adversely impacting, the African American community and things that we can do to prevent it. And as well, we invite spouses to come out. Also, we had numerous topics: cervical cancer, ovarian cancer, breast cancer, HPV. Very timely and relevant topics. Bringing in experts from all around, the state of Florida in to, really dialogue about these questions. And then, just giving the participants or the attendees a time to really interface with experts in this area, whether from the education side or in clinical practice. Or, other times when the time is very short and they have maybe 7 minutes in their clinical encounter. I mean, this was a captured audience that we had here, and we had the physicians there that graciously gave a huge amount of their time to answer every question that individuals had, to better, take control of their health and lead healthy lifestyles and, take whatever health promotion related activities they need to take, whether it's in diet, whether it's in physical activity, or whether it's in different behaviors such as, alcohol consumption or tobacco usage, really detailing the need to lead a preventive health maintenance lifestyle. And that's what the event is after, and that's the essence of it. And we're just looking to do it bigger and better in 2009 and just continue to provide these free services because, again, they're so needed, and it allows us to get over some of those cultural variables such as, issues of masculinity and trust and fear and, respect. just the typical things that really impact the clinical encounter but aren't really addressed.
All right. Well, I'm sure next year the Sisters Network will be a part of it.
We probably will.
Definitely.
Look
I don't
forward,
see why
We look
not.
forward to it.
Exactly.
Sonia, tell me about, while we have a few minutes left, about the programs that Sister Network offer, the support that you offer to your members, as well as your block walk. That is a national effort that you also do here in Tampa, and what you do during that event in October.
Right. As a support to all survivors, we have a speakers, pretty much like a speakers bureau. We network, we give them the support, we help them go through the stages of treatment with that supporting effort of knowing that someone there has been through the walk just like you're going through. And annually we have our Sisters Network Block Walk, which is nationally as well as locally, and we go out through the communities spreading the news, passing out literature, passing out information from some of our supporters of medication information, medication support for the different companies that will provide the support for medicine, because the trust, the medication, the insurance, it's really hard. So we need to, in the block walk time, we talk about the breast checks. We talk about the cancer screenings. We talk about, okay, you're young. Yes, you don't get a mammogram, but what about the CA-125 test that can diagnose or detect the cancer cells that are running? Ask your doctors about taking a CA-125 test. A lot of people don't know about a CA-125, don't know to ask their doctors for those tests. Those are the kind of things that we do at the block walk. We talk about, when was the last time you had an examination? When was the last time you went to the doctor? It's an awareness walk to get the community aware that we are here for the support of all survivors, their families as well, because with our associates, they're there for support as well. And it's a mindset of awareness.
All right, and Dr. Rivers, tell me about the Brother to Brother program, as
Sure.
well as the Speakers Bureau. That is a month, that are both monthly activities within the Florida Prostate Cancer Network.
Okay, and these are just a few of the programmatic activities that have been in place, and we're relaunching them. We have revamped them, restructured them, retooled them, and so we're relaunching them. And actually tonight will be the relaunch of Brother to Brother, which is a culturally appropriate support group targeting specifically African Americans, just giving African American men a forum to dialogue about prostate cancer, the disparity, and things that can be taken advantage of to better understand and better prevent this disease. It takes place on the fourth Tuesday of every month, so just want to put that plug in, fourth Tuesday of every month at the Lee Davis Neighborhood Service Center from 6 p.m. to 7:30 p.m. And usually the structure entails a 45-minute lecture by an expert, whether a clinician. We try and get as many clinicians out as possible, but also we've been receiving requests for dietitians and nutrition experts to come out and talk about, okay, now that I've survived prostate cancer, how can I change my dietary patterns? Even sex therapists are invited out because of one of the known side effects of prostate cancer is impotence. So a lot of individuals want information in that regard. Then we also have our Speakers Bureau that will be launching next month. Again, similar to what Sonia was just mentioning. It's just a matter of just empowering individuals that have been to the, through the experience with the needed information that they need to go out and impact change in their communities. Because a lot of people want to talk about it. They want to talk about their experience, and they want to share with others so that others can sort of get the fear out of it and just really put a personal touch to it. As well, coming in June, we have Spouses of Survivor that will be starting. We've learned that spouses want to play a key role in this process as well, but how the clinical structure is now is solely for men. So we're incorporating that role of social support, because these are the caretakers of the individuals. Once they undergo prostate cancer treatment, the spouses will be taking care of them. But if they don't have any knowledge of the disease or the side effects, how can they take care of them at the optimal level? So again, we have Spouses of Survivor that will be coming in June as well. And those are just a few of the programs that we have launching in the coming months.
All right, quickly, Sonia, can you give me the contact information website for Sisters Network?
Well, you can contact us by email at Sisters Network Tampa Bay at hotmail.com, or visit our website at sistersnetworkinc.org.
All right, that's sistersnetworkinc.org. Email is sisters Network Tampa Bay at hotmail.com. And can you give me the contact information for the
Sure.
Florida Prostate Cancer Network, please?
Free. And I'd love to hear from you. Brian Rivers, Executive Director for the Florida Prostate Cancer Network. You can reach us via website, www.flpcn.org, or via email, brian.rivers@moffitt.org. And yes, that is my email address. I'd love to hear from you. And then the telephone number where you can reach our administrative assistant, Alicia Thomas, is 813-745-6491.
All right. So I thank you, Dr. Rivers, for being with us. Thank
Thank
you,
you for having
Sonia
me.
Franklin, for being with us. And I encourage you all to get tested and to have a healthy month, year, and make sure you do what you have to do to preserve your body, your health, and your longevity. Thank you for joining us. I'm Keisha Pickett.